Hi, I'm Jordan and I'm going to give you a virtual tour of level 2 in the BCH hospital. This will be the COVID ICU. I've been through the main entrance of the city hospital and taken the passenger lifts to level 2 and have just come out of the passenger lifts. This will be a virtual tour of level 2. We will look at the donning area, where the patients are located, key pieces of equipment, fire escape exits and the doffing area. It is my pleasure to welcome you to ICU and welcome you part of the team, and we hope you settle in well during your time with us. The next area we're going to look at is going through to the restroom and where we will start our shift, and it's through these doors over here. Welcome to level 2. This is going to be one of the staff reception areas. Behind me here is the nurse coordinator's office. This is where the nurse coordinator will be based to answer telephone calls and arrange things for the guys inside, and also keep an eye on the staff that are moving in and out of the unit. And to the right of me is the allocation board, which is a bit empty at the minute, but this is where you will come to in the morning, and then you will look at the board to see what patient or what bay you've been allocated to. Going on next, we'll go through these doors to the donning area, and we will show you the donning area and how you will don your PPE for entering the red zone. So this is the PPE donning area on level 2. Again, same sort of layout. Over here will be another nurse coordinator zone if we operate on the two sides. If we're only operating on the one side, that would be more than likely we'll be using this coordinator's office. The rest of this room is laid out for donning your PPE, and again you will follow a stepwise approach and go through each station to don all the PPE required to work in a COVID ICU. We're going to go through this corridor and around the corner to get into the red zone, if you'd like to follow me. I've just walked around the corner from the donning area, and I'm now standing in an empty room before we go into the red zone. So behind me here is another fire escape exit, which we can use for staff. And behind you is actually the main corridor where the bed lifts are. So we can't exit via those doors. We'll have to walk on round in a complete circle and then doff our PPE. The only time we can use these doors is if we're discharging a patient to a ward. The patients will come down the main ward and then out those doors to a designated COVID lift. I'm going to go through these doors, and this is us entering the red zone where all our patients are kept. So we are now in the red zone on level 2, and this is the first bay. This will be beds 1 to 4, and that is in D bay. So the larger bays will hold 4 ICU patients, and the 2 smaller middle bays will hold 2 ICU patients. And as you can see here, this is the first bay, and there will generally be 1 ICU nurse in charge in this bay, and you may be supported with another ICU nurse depending on how much staff we have. Moving on up the corridor, we have the first crash trolley, and it's designated by the tape here. So this is the crash trolley. This is where it is kept for this side of the ward. The other thing to mention is these set of doors here. This is a corridor that links the 2 wards together. There's 2 of them, so this is the lower one and there's an upper one at the top of the ward. Through this corridor you will find equipment store and the sluice, and obviously a way to get to the other ward if you need to speak to the nurse in charge, doctor, or get other equipment. Behind me here is a wee alcove where there is a computer screen, and that we just use that for ordering bloods or storing notes or something. So we're now in the middle of the ward here. So this is now the second bay, which will have 2 patients in it, and then directly behind it is another small bay which can hold another 2 patients. Here we have the airway trolley. So all the patients in ICU will have artificial airway in, which helps them to breathe. Should that airway dislodge or need replaced, we will bring out the airway trolley, and it has all the equipment required to re-intubate a patient. Beside it we have a stand here, and this is a bronchoscopy stand. So the doctors can pass a camera into the patient's airway and visualise their lungs from the inside, and this sometimes can be used during intubations. Directly behind me is the nurse station, where we have the phone to phone out to the outside coordinator for equipment or various bits and pieces. The doctor will also be based here, looking up bloods and doing all their clinical work. And this is also where the photocopier is to scan items to pharmacy or various parts of the hospital. So walking up to the top end of the ward here, we have the lines trolley or the procedures trolley. If you're needing to stick in an arterial line or a central line, a chest drain being removed or inserted, then that is the trolley to go to and to be able to carry that procedure. It will have everything stock that you need for the doctor to insert that given line. If a central line is being inserted, the doctor will need the ultrasound machine, and that is located here. To the side of me here is the third bay, that is the bay of 2. And then in this wee alcove is the medicines cupboard along with the CD cupboard. The CD keys will be kept by the nurse in charge as usual. And then lastly, this is the last and final bay, which will house 4 ICU patients. And then to draw your attention to this store here, this is what we'll be using to hold dialysis fluids. To run a dialysis machine, it requires a high volume of fluids, so there'll be surplus fluids for dialysis and IV fluids kept within this store. We are now standing in the second corridor that links the 2 wards together. To my right here is an equipment store. This is where we keep surplus supplies of ventilator equipment, such as the tubing and different adjuncts for the ventilator. This will be kept here along with the ECG machine. Further on back in this store here is where all the laundry is kept. To my left here is the clinical room. It's like any other clinical room that you will find in the hospitals across the Belfast Trust. You have all your syringes and needles and the medicine fridge kept in there, and big medicine cupboards too. So I'm standing outside one of the corridors that links the 2 wards together. My time in the red zone is up and it's time to get a cup of tea. At the minute I'm also going to be fully kitted out in PPE, and I want to go and doff, so I can access the doffing area by one of the 2 corridors and walk onto the opposing ward to the doffing zone if you'd like to follow me through. So I am now on the other side, this is the other side of the ward, and I've just came through one of the adjacent corridors and now heading to the doffing area. This ward is also prepared for COVID patients and is the exact same layout as the other side. It is a complete mirror image. So to head to the doffing area, I'm going to walk to the bottom of this corridor and take a left. So I'm standing outside the doffing area. To the right of me is the main ward, which I just came down to doff. Behind yourself is the bed lift area, so we will not be exiting via that area as I mentioned before. We will only use those doors if patients on this side of the ward are going to be discharged to another ward in the hospital. So my time in the PPE is done. I'm going to head through these doors to the doffing area. So I'm now in the doffing area. As I mentioned before, then you will just doff your equipment using that stepwise procedure along all the designated bins. Just to point out, there will only be 2 members of staff in this doffing area at any one time. There will also be a bin located here to put samples into for the coordinator to come and pick up and send to the lab. There is also another fire escape exit. Now that I have doffed all my PPE, I'm going to head through these doors into the green zone and back to the nurse coordinator to go and get a cup of tea. So I'm now back to the start. This was the staff kind of reception area where we started off the tour. Behind me would be the nurse coordinator, and I've just told them that I came out of the red zone and I'm now going to grab a cup of tea. The tea room will be based on level 1. There will also be change facilities as well. So I would exit via these doors and take the lifts down to level 1 and have a cup of tea.